Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir, and the topic is the nerve supply of the anal canal. I told you one point. The upper end of the GIT, that is the upper end of esophagus, that is supplied by somatic nerve and having skeletal muscles. The lower end of the GIT, that is the distal part of the anal canal, that is also being supplied by somatic nerve, that is also having skeletal or striated muscles. Now, the anal canal above the pectinate line or above the dentate line, this upper part of the anal canal, it is supplied by inferior hypogastric plexus, that is found by sympathetic from the lower thoracic ganglion and by parasympathetic coming from the S1 and S2 segment of the spinal cord, lateral heart cells or the pelvic splanchnic nerve, by parasympathetic and sympathetic. And from this, the inferior hypogastric plexus, both sympathetic and parasympathetic nerves come to the upper part of the anal canal, that is above the dentate line. The parasympathetic is motor, secretomotor, and inhibitory for internal anal sphincter, that is, it relaxes the internal sphincter and contracts the upper part of anal canal to encourage the defecation. While and the sensory fibers are afferent fibers from this upper part of the anal canal, that is being taken by sympathetic or by both sympathetic and parasympathetic. The afferent fibers are being taken by this one, and this part of the GIT, that is upper part of the canal, is more sensitive than the rest of the GIT, and especially sensitive to stretching when it is being distended by the fecal material. While the lower part of the anal canal, it is along with the external anal sphincter, and the lower part of the anal canal, that is supplied by the branch of the pudendal nerve, that is somatic nerve. That's why this part of the lower part of the anal canal and external anal sphincter, it is under the voluntary control. That is, if you want to allow the flat as stool, you can. If you want to stop, you can. And secondly, this is highly sensitive to pain, touch and temperature, because it is supplied by a branch of the pudendal nerve, which is somatic, while the upper part is not sensitive to pain, touch and temperature, but only sensitive to the stretch reflex. Secondly, the anal canal is having one special characteristics, that is because of the nerve supply, that is part, the upper part is being supplied by the sensory or afferent by sympathetic and parasympathetic both. The lower part is supplied by the pudendal nerve. That's why the anal canal has the capability that it can selectively allow the flatus and selectively stop the fecal material. While in upper part of the GIT, you don't know that is it the flatus or it is the flatus or it is the stool and when it is. But over here in the anal canal, the individual can. This is the nerve supply of the anal canal. Thank you very much.